would probably say the biggest thing that patients report is, wow, my husband or my wife loves it. I'm not snoring anymore. That's the biggest thing. I also hear I'm sleeping better. Quite often I'm hearing, I'm not having the morning headaches. I feel more engaged with my kids, or I'm not as drowsy during the day, which is a common complaint with sleep apnea, is they just feel like they just can't get enough rest, or I haven't felt like I need to have my afternoon cup of coffee to get through the rest of the day, so just feeling overall a sense of more energy. Occasionally, one of the things I do want to talk about is that there can be some complications, but they're very few. But one of the common complications with it is just this whole learning for the muscles to understand what's going on, because I kind of liken it to going to the gym for the first time. If you haven't been to the gym for a while and you're lifting some weights, you kind of have to train your muscles, right? And during those first few weeks of acclimating to any type of exercise, you have a little soreness. Well, our muscles are no different. Our jaws are used to being kind of in the center of the joints, and we just kind of open and close, and that's the position we work at. Well, what we're trying to do with the airway is to bring that jaw down forward and kind of holding that jaw open. Sometimes these muscles will get a little tension and soreness in them, but what we talk very much about before we even start therapy is this is how we're going to prevent that, or this is how we're going to control that side effect that can happen. And we have an appliance that the patient will wear first thing in the morning when they get up that retrains the muscles to go back to where, the jaw joint to go back to where it needs to be, and we call it recapturing the bite. You start closing into that, and the muscles start to go, okay. It starts to learn over time. This is my nighttime position. This is my daytime position, forward and back. And it's just once those muscles kind of get what's going on, then there's usually not a problem. Occasionally, I think it's maybe only happened a couple times that we'll have to call for some, ibuprofen or some muscle relaxants to kind of get through that learning curve of the muscles understanding what's going on. But our bodies are pretty adaptive, and there's very few complications with this. Occasionally there can be some minor bite changes, and those again from when I say we, the dental field, or treating with oral appliance in general, the second part of teaching the body how to recapture the bite in the morning was something that wasn't done. So we were just training the muscles to be forward, and then they kind of just stayed there. So then people would have teeth touching just up front, or just, the teeth position themselves didn't change, but the muscles didn't learn to relax and go to the back position. But since we've come a long way in our understanding of oral appliance therapy over several years, this is the common thing that we do, and we find that those complications afterwards are few and far between, and they're really driven by how well the patients comply to what they're supposed to be doing with their exercises first thing in the morning. So if a patient doesn't want to have those issues, they'll do the protocol, and they typically don't. It's very uncommon to have long-term side effects from it.